So, are you a real doctor yet or not? I get this question so many times and it gets kind of annoying to explain sometimes. So, I'm going to break it down in this video of what these stages of medical training look like and what it means to be considered a medical doctor. My name is Dr. Raghav Sharma. I am a physical medicine rehabilitation physician and interventional spine fellow currently. What does it mean to be a fellow? You'll find out in this video, but I've made videos for quite some time, and this is kind of a little bit of a rebirth to my channel. So if you're new here, then welcome. We'll do a little bit of an intro video at some other point, but let's get straight to the topic of the stages of medical training. Medical school is typically considered the first part of medical training. However, there's a lot leading up to it even before you start medical school. And this is an undergraduate coursework where most medical schools require some level of effort as far as pre-medical courses. So there are some required courses that you must take, such as organic chemistry, which is everyone's bane, and several others, which I don't know off the top of my head. However, there is required coursework to apply to medical school. On top of that, there are standardized exams such as the MCAT, of which you have to score pretty decently because medicine is pretty competitive. So you have to study pretty hard to get even into medical school. A common misconception is that you have to do a degree in pre-medicine or a pre-med degree. However, this is not the case. You can actually get a degree in any single sort of major that you want as long as you complete a 4-year degree. For example, I did biomedical engineering in my undergrad, but also on the side completed my pre-med coursework to apply to medical school. So that's kind of everything that goes into it. Obviously, there's a lot more. There's like extracurriculars you're doing, hobbies, whatever it is. Medical school is competitive, and a lot of these people going into medical school already have extremely long CVs of things like research, community service, whatever it may be, but all of this is to get into medical school. Now comes the main portion of medical training, medical school. Medical school is 4 years and typically consists of 2 years of preclinical work and 2 years of clinical work. And pretty much this just means that in the first 2 years, you are primarily doing didactics, which is you are learning the bread and butter of medicine. You are learning the in-depth details of how a lot of the body works as far as anatomy, physiology, the different systems in the body, pretty much how the body works. In those first 2 years of preclinical work, there's typically a bunch of tests relating to whatever the organ systems are. And then there's also the first big board exam, which is step 1, or for DO students, COMLEX level 1. For a brief note on the differences between MDs and DOs, there's no real difference. The only difference is that DOs also do osteopathic manipulative medicine within their curriculums, which is about 200 hours in addition to whatever MD students are doing. Otherwise, not really a big difference. The clinical years of medical school are spent within hospitals and clinics, wherever the setting is, of learning hands-on medicine of how things really work. It's how to apply those didactic years to the clinical work and really see how we manage patients as they come in the door, as they're in the hospital, and how to safely discharge them. There's not a whole lot of responsibility at this time, unless a medical student is really stepping forward to take that, probably near the end of their 4th year, but there's a lot of learning going on, and this is where really you start integrating things and to learn into how to become a physician. During the clinical years, there's another big board exam, and this is step 2 or COMLEX level 2 for DO students out there. And just as an aside, some DO students also take USMLE and COMLEX like myself. So you take these exams, and then at some point during your clinical years, you get ready to apply for residency. Residency is kind of the big on-job training for whatever specialty you want to do. So at some point in your clinical years, you decide on a specialty and you apply. And by the time you're kind of almost done with your 4th year, you have matched into a specialty and you know what you're going to be doing for the rest of your life. I'm not going to get into the match process in this video because it's extremely lengthy, but that's medical school in a nutshell. By the end of it, you know what specialty you're doing, you have matched into a program, and you have a pretty good understanding of medicine, at least the basics. As you graduate medical school, you are now officially a doctor. So if anyone asks you, are you a doctor yet? Once you graduate medical school, the answer is yes. You have completed your doctorate of medicine or doctorate of osteopathic medicine if you're a DO student, and you are officially considered a doctor. Now, the real part of this is that you still have to do an internship and a residency to be able to really understand how to practice that medicine, which is the next part of this video. Every specialty is different as far as residency length, depending on the amount of information, the amount of training that you need to safely and sufficiently practice that field. And they range anywhere from between 3 years all the way to 7 and even 8 years sometimes, depending on if you take gap years, research years, whatever it may be during your residency. But for the most part, all residencies in their first year are much more generalized training. So if you're in a much more medical type field where you're dealing with more medications and whatnot, then you're going to be doing a medical internship. If you were doing a surgical field in residency, typically you are going to be doing a surgical internship. And those are kind of the two types of years that you have for your intern year. Sometimes they're combined in between, like a transitional year, which is what I did, which I think provides a very good balance between the two. However, mostly you're not really starting your specialty until the second year. At some point during your intern year or during your residency, you take the next big exam, which is USMLE Step 3 or COMLEX Level 3. I took this near the beginning of my intern year just to get it out of the way. But once you pass this exam, you are licensed to practice medicine in that state after applying for licensing, obviously. But you have completed all of your real board exams to become a general doctor. Technically, at this point, you are a fully licensed doctor and you can practice medicine, maybe not the way that you want and maybe not in this field that you wanted to go into, but after completing your intern year and Step 3, Level 3, you can open up, let's say, a med spa or do some sort of generalized medicine. You probably will not have hospital privileges anywhere or have any sort of freedom to do what you want, but you technically are a licensed practicing doctor at that point. Most physicians go on to complete their residency in whatever field it is of their choosing, and mine was in physical medicine and rehabilitation, which is another video on my channel, so go check that out either right here or right here. But by completing this residency, you have completed your training in whatever that field is, and you are competent to practice right away and start seeing patients independently once you're done. Residency is really on-the-job training, starting out with the most supervision right when you start, all the way to when you graduate with pretty much the least supervision. So people who are at the end of their residency really are not having that much supervision from their attending physicians, given that they're progressing adequately and normally, just to give more autonomy so that you really understand how to practice and you're not being handheld at that point. So graduating PGY7 neurosurgeons or physical medicine rehab residents at PGY4 really are doing most things by themselves. They're just saying, hey boss, you cool with that? And that's about it. At some point in residency, a resident may decide, hey, I really like this one specific niche topic within this field. Let me go do a fellowship in it. And that is what a fellowship is. Essentially, it's even more training in a very niche aspect of whatever specialty it is that you're doing, so that you can get really good at that one part of it and kind of dedicate your career to it. So once you get on with residency and you finish residency, you are pretty much ready to practice in that specialty so you can get a job in that field. However, people who choose to do a fellowship go through a very similar match process and they end up becoming a fellow wherever it may be. However, they are still fully graduated from their specialty. So they can practice that specialty kind of without any hand-holding. However, they might need more training for their specific fellowship. This can get confusing. However, here's an example. So I'm an interventional spine and musculoskeletal medicine fellow. So essentially anything relating to interventional spine where I'm sticking needles in spines, I need some sort of supervision for. Whereas anything physical medicine rehabilitation related, like managing spinal cord patients, traumatic brain injury patients, stroke patients in a rehab unit, I don't need supervision for anymore because I've completed my training and I feel very confident to take care of them individually. Thus, a fellow is fully qualified to practice within their specialty, however, not within that one fellowship category. So a lot of fellows will do quote unquote moonlighting or working on the side or extra outside of their training hours as a fully functioning attending physician in whatever their base specialty is. And I will be doing the same here in Phoenix. In addition, after graduating residency, every field has their board licensing exams. And now this isn't like the USMLE series or the COMLEX series. This is specialty dependent. So for example, the American Board of Physical Medicine Rehabilitation has a board, the American Board of Internal Medicine has a board, and all of them have separate exams to make sure that you are qualified to practice that specialty. And typically you have a couple of years to take this exam or to pass this exam. While you're doing that, you can still work in that specialty, but you kind of have to pass to become accredited within that specialty. If for some reason you do not become board certified, or at some point you kind of lose that board certification because you've made some questionable choices in life, then you can still practice that specialty. However, you may have restrictions on what you can do based on your employment, because a lot of hospitals and a lot of clinics and employers want board certified physicians because it has some sort of meaning as far as a qualification or a vetting that you kind of know what you're doing. So right now I am finished with my residency and I am a fully completed physical medicine rehabilitation doctor. However, I have not completed my board, so I cannot say I am board certified. This does not mean I can't get a job as a physical medicine rehabilitation doctor. It just means that I have like 2-ish years to 3 years to kind of finish that up and make sure that I'm in good standing to kind of continue on employment. Really, it only becomes an issue after like 3-ish years that you have not still become board certified in that specialty outside of residency. And lastly, at the very end, when you have completed fellowship, you are done with your training if you have chosen to do a fellowship. A lot of people choose not to do a fellowship and go straight into practice, at which point they're attending physicians. However, for those like myself that choose to do a fellowship, I will only become an attending after my fellowship year, and that is the end of training. It's a long, grueling journey. A lot of times we are in our 30s to mid 30s as we finish training, but hopefully, and it will, be worth it at the very end. Thank you all for watching this video. I hope this cleared up some questions, and if not, then leave them down below in the comments and I can go and answer those. Thank you all for watching this video, and once again, if you're new to me, thank you for watching till the end, so you can subscribe down below. And I have vlogs coming out weekly, kind of on my medical journey and progress, as I do a whole bunch of other things as well on the side. So once again, thank you all for watching. I'll see you in the next videos.